get you on your right side, so I want you to turn towards
After you have the patient lying on her right side, preparatory to percussing the spleen, flex the patient's left knee. To assess the size of the spleen, percuss the left lower anterior chest wall in a lateral direction, noting the extent of tympany. Tympany suggests that the spleen is not enlarged. In the epigastrium, you may hear the tympany of the gastric air bubble.
Okay.
Next, check for a splenic percussion sign. Find the lowest interspace in the left anterior axillary line and percuss there.
Okay, take a deep breath.
If tympany is heard,
Hold it.
ask the patient
Let it
to
out.
take a deep breath as you continue to percuss in the same place.
Hold it.
When
Let it
spleen
out.
size is normal, tympany usually persists.
Okay, good.
An enlarged spleen is considered unlikely. When the spleen is enlarged, tympany often changes to dullness. Dullness is a positive sign. It may be falsely positive, but its presence means you should perform careful palpation. Palpate the spleen to assess its size. With your left hand, reach over and around the patient to support the left lower posterior rib cage and the adjacent tissue. Place your right hand on the abdomen low enough to detect a large spleen and point your fingers toward the costal margin. When the patient takes a deep breath, try to feel the spleen as it comes down to meet your fingertips. Repeat several times, moving your hand gradually from the lower quadrant toward the costal margin.